Next speaker is Emily Pennoyer. Please go ahead.
Thank you so much. I'll just share my screen here. And can you hear my audio okay on Zoom and those in the room? Okay, great. Yep. Well, thank you. My name is Emily Pennoyer. I currently work as a toxicologist for the Maine CDC, but I'll be presenting today work that I conducted during my doctorate at Boston University School of Public Health. So I will get started here. I'll be presenting today some of the work that we have been doing on the CARE study, along with several collaborators at Biomonitoring California. My co-authors and I have no conflicts of interest to disclose. So the CARE study, as some folks may be familiar, was designed by Biomonitoring California as a series of cross-sectional studies measuring environmental chemicals in California adults living in 3 regions in Southern and Eastern California. Participants were recruited sequentially in 3 phases during 2018 to 2020. And recruitment was done using a convenient sampling approach with applied quotas by subregion, gender, and race and ethnicity to improve representation of the underlying population. CARE-LA included 430 adults from Los Angeles County recruited in 2018. CARE-2 included 359 adults from Riverside, San Bernardino, Imperial, Mono, and Inyo counties recruited in 2019. And CARE-3 collected samples from 90 adults in San Diego and Orange counties in 2020, though the full recruitment from CARE-3 was not completed due to COVID-19. Serum was collected and analyzed for 12 PFAS from 879 participants. Personal demographics and residential addresses were collected using survey questionnaires. People can be exposed to PFAS from multiple sources. Ingestion of contaminated food and water are 2 of the best studied routes of exposure. The majority of studies in the US have focused on legacy PFAS in water supplies, particularly in populations where drinking water supplies have been heavily contaminated. For example, private wells impacted by a nearby fluorochemical facility. Studies have shown significant associations between concentrations in private well water and concentrations measured in serum, providing evidence to support a linear relationship between PFAS in drinking water and serum. PFAS used in indoor materials like carpeting and furniture can migrate into dust, which can be unintentionally ingested. Some PFAS have been measured in cosmetics and may have the potential to be absorbed through skin. And people can also be exposed indirectly through inhalation of precursor compounds that can break down to form legacy PFAS, as well as other sources that are less understood. So while several exposure pathways have been identified, the extent to which people are exposed from different sources is not known. The general population can be exposed to PFAS in drinking water supplies as well, which has been linked to nearby wastewater treatment plants, airports, military training areas, and industrial facilities that use PFAS in their processes. This map shows the detection of PFAS in public drinking water supplies, serving over 16 million US residents. The data shown here were collected in 2013 to 2015 as part of the EPA's 3rd Unregulated Contaminant Monitoring Rule. It's also called UCMR3. Human exposure studies in the general population, including the nationwide Nurses Health Study and the California Teacher Study, suggest relatively low levels of legacy PFAS in drinking water can lead to elevated levels in serum. In these populations, large exposure sources are not known or have not been documented. People can also be exposed to PFAS through their diet. PFAS used in grease repellent packaging can migrate into foods. Foods can become contaminated when grown in soils that are amended with residuals from sewage sludge, also called biosolids. Contaminated crops used as feed for livestock can result in elevated concentrations in cattle and dairy products. The contaminated fields can also result in elevated concentrations in chicken eggs and other agricultural products. And some PFAS can bioaccumulate in fish and shellfish. The traditional approach used in exposure assessment relates the concentrations of PFAS measured in food, water, dust samples with internal levels estimated in blood, usually in an estimated daily dose, like a nanogram per kilogram body weight per day. Studies using this approach in Europe and Canada estimate diet to be the major source of exposure in the general population. However, much of the existing data on dietary exposures come from Europe and can't be easily applied to the US due to differences in dietary habits. Also, the timing of when samples were taken is important because levels found in food and water reflect chemical production from that time period. Many studies on diet are from several years ago, and PFAS production has changed dramatically in the last 2 decades. There's limited data available on levels of PFAS in foods in the US, with the exception of seafood, but even these data are quite scarce. So in absence of these data, we can use an alternative approach that combines biomonitoring data, which measures PFAS in serum directly, with questionnaires on potential exposures. This approach uses epidemiological methods and regression to estimate differences in exposure from various sources and can provide insights into dietary consumption patterns that are associated with increased serum PFAS, and ultimately help identify potential opportunities to reduce exposure. Cross-sectional studies in the US using this approach have linked serum concentration to increased consumption of animal products and certain packaged foods. But many of these types of dietary studies have relied on older biomonitoring data, which may not reflect more recent changes in PFAS production, and do not account for contributions from drinking water or potential confounding from other sources. To our knowledge, no study has used the epidemiological approach to assess contributions from diet and water simultaneously. So using data collected in care, our goal was to characterize PFAS body burden in the care population and estimate the relationship between serum PFAS with diet and drinking water. Participants in care completed food frequency questionnaires prior to serum collection, and they were asked how many times in a typical week they eat different types of foods. These questionnaires were typically completed within 3 weeks prior to serum collection. To assess drinking water exposure, finished drinking water data from UCMR3 were linked to residential addresses of care participants using the polygon feature layer, which was developed by the State Water Resources Control Board. For the purpose of this analysis, drinking water exposure was characterized using a binary variable based on whether or not an analyte in UCMR3 was detected above the reporting level. This is different from some other care analyses. For example, Toki-Filman is using the care data in conjunction with the California Water Board PFAS monitoring data from source wells. So there are some important differences between the UCMR3 data used in this analysis and the California Water Board data. UCMR3 monitoring was from finished water, while the Water Board sampling focused primarily on source wells, which is untreated, though they did have some samples that included treated water. The UCMR3 data included all public water systems serving over 10,000 people, while the water board monitoring focused on areas with known or suspected PFAS contamination, for example, wells near potential sources like airports, landfills, and military facilities, or those that had detections previously from UCMR3. The California Water Board data also has 10 times lower reporting limits than UCMR3 and analyzed a much broader range of PFAS. And just lastly, the availability of water data overlapping with care participants resulted in slightly different sample sizes. So this analysis had 700 participants. Toki's analysis has 563. In our analysis, our goal was to estimate the causal relationship between two exposures, diet and water, and levels of PFAS in serum, such that intervening on an exposure would lead to a reduction in serum concentration. We used robust linear regression to model the additive relationship between multiple exposures and non-transformed serum concentrations. Unlike the traditional approach that uses log transformation to address issues with skewed data, which is typical in environmental data, robust regression downweights extreme values to relax the assumptions of regression. We chose not to log transform serum concentrations because this imposes an exponential dose-response relationship between the exposure variables and serum. Robust regression allows us to model the linear additive relationship that's been shown to exist between exposures and serum at steady state concentrations. This also means that our results, the beta coefficients, are reported in absolute terms, a nanogram per milliliter increase in serum per change in exposure, rather than the relative percent difference that is generated from a log linear model after exponentiation. And lastly, the covariates in our analysis were selected using a directed acyclic graph, also known as a DAG. A DAG is a diagram used in epidemiology to describe the causal relationships between variables informed by what we know from the literature and to identify potential confounders. So the potential confounders in this analysis were identified if they influenced exposure and acted as predictors of PFAS concentrations in serum. There were 700 care participants with complete serum and survey data that successfully matched to public water systems monitored in UCMR3. When possible, we used imputed demographic data for any missing observations. About 60% of the study participants were female. Most participants had completed some education above high school, and the majority of participants were either Hispanic or Latino or white. Serum was analyzed for 12 PFAS by the Environmental Chemistry Laboratory at DTSC. 7 PFAS were detected in 65% or more of participants and included in our analysis. The box plots on the right show the distribution of the 7 PFAS analytes in serum. Each of those analytes is listed along the x-axis, and the concentration of each analyte is on the y-axis. You'll notice this is a log scale. The horizontal bars on each of these boxes represents the median concentrations. So the highest median concentrations in our study was observed for PFAS and PFOA, though in general, serum concentrations in care were somewhat lower than those reported in the general US population, based on data from a similar time period. 4 of the 6 PFAS measured in water supplies under UCMR3 overlapped with the PFAS included in our analysis. I've listed those here: PFOA, PFAS, PFHXS, and PFNA. The minimum reporting levels for these PFAS ranged from 20 to 40 parts per trillion. PFOA and PFAS were detected most frequently, and about 8% of participants had at least one of these 4 compounds detected above the reporting level in their drinking water supplies. No water supplies in care that were monitored in UCMR3 data had detectable levels of PFNA. The California Water Boards monitored a larger suite of PFAS in source wells and at lower reporting limits. But for the PFAS shown here, the minimum reporting level for the source wells was 4 parts per trillion. And as indicated on the right, the lower reporting limits resulted in much higher detection frequencies for these 4 PFAS using those data. This figure shows the average frequency that participants report eating foods in a typical week, with the number of times consumed per week on the x-axis and the different food groups in our analysis on the y-axis. Categorical survey responses from the exposure surveys were converted to a continuous numerical variable for our analysis. Seafood here includes fish and shellfish. Dairy includes milk and butter. These are consumption frequencies, but they do not take into account how much of each food was consumed because portion size was not asked about in the survey. Our results showed positive associations between serum levels and PFOA and PFHXS in drinking water. We also saw significant positive associations between levels of PFAS in serum and consumption of seafood, eggs, as well as brown rice. We observed other positive, non-significant effects for PFAS, including red meat and dairy. And unexpectedly, we observed significant negative associations between some PFAS and heat-at-home foods. These were described as store-bought food that you heat in its paper or cardboard package. So care participants were given examples such as pizza, frozen meals, and garlic bread. These are the beta estimates from the robust regression for dietary effects that were highlighted in the previous slide. This is showing the change in serum PFAS per weekly meal consumed. Again, these reflect the absolute difference in nanograms per milliliter associated with exposure. These methods prevent direct comparison between our beta coefficients and those from studies that log transform serum concentrations, but qualitatively, several of the patterns we observed were consistent with previous studies, including significant associations between seafood and long-chain carboxylic acids, as well as egg consumption. The positive associations for PFAS, while not significant, are also consistent qualitatively with studies that have shown positive associations between serum PFAS and consumption of animal products. We do not think that the heat-at-home foods are causing a reduction in serum PFAS, as the negative beta coefficients here would suggest. Instead, we suspect there may be residual confounding related to packaged heated foods and serum PFAS, perhaps through some socioeconomic factor not adequately controlled for in our analysis. So unlike other environmental pollutants, people of higher socioeconomic status typically have higher serum levels thought to be related to consumer product use. This is just one hypothesis we have that might help explain the negative associations that we see. Care participants with detectable PFOA and PFHXS in drinking water showed higher serum levels of these PFAS compared to those without, with the most significant increase seen for PFHXS, which was 0.64 nanograms per milliliter higher on average for those with detectable levels in their water. And I will add a note that Toki's analysis using the California Water Board data also showed the greatest effect for PFHXS. Overall, our study quantified PFAS exposure in the care population and identified possible sources and behaviors associated with increased PFAS body burden. Specifically, drinking water being identified as a source of exposure to PFOA and PFHXS, which provides further evidence that relatively low levels of PFAS in public drinking water contribute to PFAS body burden. Diet may influence certain PFAS in serum, like those effects seen for PFNA, PFUNDA, PFDEA, and mucosa. But based on studies that suggest diet is a major source of exposure, we expected to see more positive associations between PFAS and foods. This could partly be due to shifts in PFAS production, leading to lower concentrations of legacy PFAS in foods. We don't have conclusive data to understand how levels of PFAS in the US foods have changed. But we do know that legacy PFAS like PFAS and PFOA are no longer being used in food contact materials, and this would likely lead to lower levels in foods. The FDA only started measuring PFAS in a subset of total diet study samples in 2019, but recent results from store-bought seafood and processed foods have shown limited detections of PFAS. And of the foods with detectable levels, concentrations are several fold lower than foods analyzed in the 1990s from the Canadian Total Diet Study. So while these data are limited, they could suggest declining levels of legacy PFAS in foods over the last 20 years. The strengths of this work, we had a large, diverse general study population and recent biomonitoring data collected in CARE. Other strengths include using robust methods to estimate effects of PFAS body burden from multiple sources of exposure, and using information from the literature to guide our thinking around the selection of model covariates. The CARE study also includes data on compounds like PFDEA and PFUNDA, which are not always included in biomonitoring studies. This work also had several limitations. Our assessment of diet was semi-quantitative, and we know that food frequency questionnaires can introduce error associated with self-reported food consumption. The high reporting limits for UCMR3 were also a major limitation, and contributions from drinking water at lower levels of exposure could not be assessed in this work. But hopefully Toki's work using the water board's data will address this, at least partially. The high reporting limits and low detection frequency in this study led us to categorize drinking water exposure into a detect, non-detect variable, which may also have introduced exposure misclassification. As mentioned earlier, we cannot rule out the possibility for residual confounding from other exposures, like indoor exposures, though we did try to reduce this by controlling for factors that link indoor exposures and diet and water. Lastly, this analysis used unweighted data and therefore may not be generalizable to the larger population. With that, I would like to thank my co-authors and collaborators, Dr. Wendy Heiger-Bernays and Dr. Tom Webster from Boston University, as well as the staff at Biomonitoring California and the CARE study participants and our colleagues at DTSC for all of their great work in the laboratory. Thank you so much.
Time for clarification questions from the panel. Saw Tom's hand.
Tom McCone, University of California, Berkeley. Thank you. That was really interesting work. Congratulations on finishing it and being able to present it. I just want a little clarification. I think the way you did this is really effective. Not trying to get too quantitative, because then you get into all these issues of how much food people eat and start multiplying numbers by numbers you don't know. So I think it's more powerful just showing the relationships. And I think you alluded to it. I'm just curious about some of the relationships between food and drinking water, because a lot of foods we prepare, use the tap water, like when you make rice and pasta, and even some vegetable, a lot of things we make at home, we add water. And I know it kind of shows up. I don't know if you went into that more deeply about how the use of water in preparation affects the relationship between drinking water levels and food intake.
Yeah, we did consider this in a few different elements of our analysis. First, is our measure of the effect of water in food preparation being accounted for in our measurement of water that was linked to the UCMR3 data. But we also looked at this through a number of sensitivity analyses to see, how our results maybe would look different if we modeled the effects of food without including water in our model, and vice versa, if we modeled the effect of water without accounting for food preparation. The results of those sensitivity analyses didn't show major differences in our beta estimates for most of the analytes that we looked at, which to us would suggest that, those two sources are not confounding each other. There may be other ways that we could look at this. I think particularly if we had data like Toki's that rather than a more crude estimate of exposure with detect and non-detect, there may be more opportunities to suss that out a little bit more. Does that answer your question?
Yes, very good. No, I think that's a very effective way. The sensitivity analysis is really, in my mind, that's a really useful way to see if there's an effect. Just do the with and without and different options and see if it makes a difference. So that's good. Thank you.
Other clarification questions? Amy?
Maybe it's more substantive stuff.
We have a fuzzy line.
Okay. Thank you, Emily. This is really interesting work. I was also wondering, given the low or I guess the high reporting limits for UCMR3, I was wondering if you had any plans to access the UCMR5 data. Oh gosh, it's not on. Sorry. And I forgot to say my name. Okay, Amy Padula. Rewind. Great job, Emily. I was wondering if you were planning to examine the UCMR5 data, which is, I guess, still in the process of coming out, but some of it is available to verify some of the UCMR3 data and have lower detection limits. If there are more sensitivity analyses in your future, or perhaps maybe for another study.
Yeah, we did take a look at the UCMR5 data to see how much of the available data overlapped with the CARE participants. As you noted, that data is still coming out, so it's not complete. But our larger concern was around the timing of the UCMR5 data collection. Since UCMR3 and the serum collection for CARE, there have been many events in California that may have impacted water concentrations. Some of those include orders that went into effect concurrent or after serum collection around notification levels. So it was more a question of the temporality with the UCMR5 data, that it's likely that those levels are no longer reflective of what CARE participants were drinking in the years leading up to serum collection. Although it would have been nice to have some data to cross-reference with lower reporting limits. Though future analyses, hopefully we'll be able to use that UCMR5 data for analyses similar to ours.
Other questions beyond the clarification?
Actually, this is Stephanie Jormal. I have a clarifying question. When you asked about seafood consumption, did you differentiate between shellfish and general fish?
There were differences across the care regions in how participants were asked about their seafood consumption. Some participants were asked more specifically about freshwater fish, or sorry, self-caught fish versus store-bought fish, and differences in seafood combined versus shellfish. And I think that Narissa in the room might have a few more details on the specifics of those questionnaires, of which ones were asked which questions. But for the purpose of being able to harmonize the food frequency questionnaires across all 3 study regions, we decided to combine shellfish and seafood to match the participants that weren't asked to differentiate.
Thank you.
Laura has a question.
Hi, Laura Cushing, UCLA. Great presentation, Emily, really interesting. I had a quick question about whether.
Speak closer to the mic. You're kind of quiet.
Oh, can you hear me now?
A little bit.
That's better. Thank you.
Should I start over?
Yes.
Okay, Laura Cushing, great presentation, Emily. I was wondering whether there was a question about bottled water usage.
Yeah, participants, sorry, go ahead. Was there another part of the question? Participants were asked about their drinking water source, and bottled water was one of the options. And is that my sound coming in? Okay. So people were able to respond whether they used public water supplies, private wells, and bottled water consumption. We limited our analysis to everyone on public water supplies. We did not take into account amount of bottled water consumption. So we were really just looking at detect and non-detect of the public water coming into their home. But that's an important consideration. I think if you were to go look at bottled water consumption, there might be more beyond the scope of what we were doing in our study that would be interesting to look at.
So just to make sure I understood you correctly, people who reported drinking bottled water were excluded from your analysis.
No, people who reported having a private well were excluded from the analysis. But if their house was served by public water supply, they were included. Any additional stratification based on tap water versus bottled water consumption was not considered.
I see. Okay, thanks.
But we have Toki online too, who I think also wants to say something.
Hello, can everyone hear me? Great.
Yes.
Toki Philman from Biomonitoring, California. And as Emily mentioned, we carried out kind of a parallel study focusing on the care study participants, looking at exposure to drinking water and associations with serum using the California Water Board's data. And I just wanted to add regarding the bottled water question that there's just over around 40% of care participants who report drinking primarily bottled water. But in our analysis, when we stratified participants by people who primarily drink tap water versus people who primarily do not drink tap water, which is mostly bottled water, we found that the association for PFH excess was stronger among people who report primarily drinking tap water, suggesting that this effect is indeed from tap water. Thank you.
Any other questions? We can invite clarification questions, but also more substantive questions if you have them.
Nothing from the audience at the moment.
I wanted to expand a little bit more on the water source question. And I don't know if, I mean, I know a lot of people have filters, or refrigerators now come with filters, almost standard. The activated carbon filters. I don't know how much they pull out the PFAS type compounds. That's a hard question to ask, but I'm guessing if people get a lot of their water from filtered sources, or if they have a filter on their sink, that means, and again, I don't know the efficiency of these filters for removing these compounds, but it might be an interesting follow-up, something to look at in terms of how many households could be removing the PFAS type compounds with their filtering system.
Yes, and I don't know the range of efficiencies of those different types of filtration, you know, countertop, under sink, refrigerator. Some of them are very effective at removing PFAS. I think your question is right. That would be a hard thing to assess with this data based on the type of, you know, given that so many of those filters are out there and their efficiencies can range. But it is certainly something worth considering.
Hi, I have a question. Very nice presentation, very interesting finding. Actually, two questions. So for the takeout group, I'm assuming that you did not find any associations, right, with any of the PFAS measures.
For the takeout, we did not find significant associations with takeout, but we did see associations, the negative associations with the packaged heated food.
Negative associations.
Yes.
Okay. Well, I mean, a lot of the PFAS have been phased out since what, 2016, 2017, somewhere around there. So, and other than the short chain PFAS, which you don't have any measures for, which would be very interesting to and then jumping into the heat at home, right? So the negative associations, I think you're mainly thinking this is more residual confinement or a construct of socioeconomic status, I'm guessing. Do you know what other socioeconomic constructs that may be available for you to dig in a little bit deeper?
Yeah, I think that the potential for confounding that we're looking at, you know, our thinking is that we have perhaps an imperfect measure of socioeconomic status. We're using education and income as proxies. We also know that education and income are imperfect proxies. There's the, you know, overeducated, underpaid, you know, associations that exist for folks. So it may be that there are, you know, additional socioeconomic differences that are not adequately controlled for with the variables that we have. It's also perhaps worth noting that, you know, in these exposure surveys, income can often be, you know, misreported or not reported at all. We used imputed data for those observations when we could, but it's possible that the methods that we were using to, you know, ensure complete data set were imperfectly controlling for the real true differences in socioeconomic status. So that doesn't answer your direct question about what else not included in our analysis might we consider. I would have to think on that a little more to see, well, what other data would we want to have to make sure that, you know, the association that we're trying to measure here is adequately controlled for.
Okay, so I'm just looking at your slide here. You're saying that you did adjust for income?
We did.
On the slide, it doesn't list it, but maybe it's just an omission there.
Oh, I'll double check that to make sure that the correct information is available for the slides that are posted.
Okay, all right, so interesting for the income. I just lost my train of thought there. Oh yeah, so I mean, it'll be interesting to see what other data is available, if there's housing, other types of housing data, owning, renting, or what type of housing, that you may be able to create some sort of factor analyses about housing situations in
Yeah.
relation to income.
Yeah, there have been some interesting studies looking at, housing year, as well as cleaning habits in the home, mopping and dusting. I think another consideration we had to work with this model, we had lots of covariates and, running into challenges of potentially including too many covariates in the model, especially considering, the size of some of our groups of people with water detections, and ensuring we had enough, power to be able to do that. Not to mention that the robust model sort of runs in this iterative process, and some of the challenges of working with the specific model we use is particularly when there are lots of covariates in the model. So thinking a little bit harder on future analyses, to adjust for those socioeconomic differences. Yeah, I think will be really informative for this work moving forward.
Yeah, I think so. I mean, there's different ways, right? You can create indices for a construct, in this case of housing, for example, or some sort of a construct for socioeconomic status that may incorporate, like through factor analyses or something related to that, you can incorporate the scores of different related variables, and then you're just adding really one more covariate to that. Very interesting. I mean, it's important to dig in a little deeper with the heat at home, because probably the heat is not introducing PFAS into the air and they're inhaling it or something like that. I think you're right. I think it's probably more of a socioeconomic construct, but important to dig in a little deeper if you have it. Very nice, very interesting presentation.
Thank you so much.
We have about 10 minutes for questions. Comment?
Go ahead, Laura.
Sorry, this is Laura Cushing again. Are we in the constructive, are we in the clarifying questions section or the?
Any question?
We take anything now. Try to keep your questions up maybe a bit shorter. We have about 10 minutes for our next speaker.
Okay, great. I was just curious about, it looked like, if I understood correctly, maybe 20% of participants were excluded because of missing data from your analysis. And I guess I'm just curious, like how their PFAS levels looked compared to the ones that you did include in your analysis. And I'm just thinking, about the drinking water, because UCMR3 doesn't require every system to test, and smaller water systems often have higher contaminant concentrations of different contaminants, not necessarily PFAS, but other things. Just if there's anything we can say about, or you might be able to say about the ones with missing data on drinking water levels, so that we're not just kind of assuming, there was no data, so there's no problem, and these folks don't have measurable PFAS.
Yeah, and Toki might be able to chime in at the end of this if he wants to add anything. We did look at the characteristics of the study participants, the 879 participants, and the 700 that we included. So the participants themselves in those studies were, in those two groups, were very similar. I say that just to point to, we're not expecting the subset of folks that we've included in our analysis to bias our estimates. But to your point, the results that we're looking at may not necessarily be generalizable to people in smaller water systems that we didn't have data on. I don't know off the top of my head how the distribution of PFAS in smaller versus larger water systems, how those play out. I think that key factors to that are going to be proximity to nearby sources. So airports, we think of being near larger water systems that may not be impacting a smaller water system. But there are other sources that might be influential that the smaller system, not included in our study, could still be significant. So I don't know off the top of my head what that dynamic is, but and it
we
may
do
be
have
different from
Toki.
state to state.
Yeah, we do have Toki, who I think also wants to provide comment.
Thank you.
Hi,
5
this
more
is
minutes.
Toki
Any
Philman
other
again from
questions?
Biomonitoring California. To address that question a bit, so as Emily mentioned in her presentation, her study includes 700 participants. Ours included 563, but there's actually a lot of overlap between our studies and also the water systems that the participants were matched to tend to be, as you mentioned, larger water systems. So in our work, we also did compare the serum PFAS concentrations of the participants included in the study and the participants excluded who would be matched to smaller water systems, and the overall serum PFAS concentrations were actually pretty similar between the groups.
Thank you for adding that, Toki.
We have one more comment from the room.
This is Dina DeBraca, Biomonitoring California staff member. It's not applicable to this study, but UCMR5 released the January data update earlier this year that accounts for about 2/3 of UCMR5 data. And they have one table in that data update, which addresses PFASs with a maximum contaminant level. So that would be PFOA, PFAS, PFHSX, PFNA, and then they have this like composite variable. And they stratify that table by large and small water systems within UCMR5. And they found that there was a higher proportion above the maximum contaminant level for PFOA, PFAS, PFHSX, but the flip for PFNA, at least for UCMR5 data.
Any last questions? We have a few minutes, couple minutes. And then our next speaker.
Nothing from the attendees online. I think we can go ahead and move on to Wendy. There's no other questions.
Go on to the next speaker.
Okay.
Okay. Next speaker is Wendy Linck. She is a senior engineering geologist in the Division of Water Quality in the State Water Resources Control Board. She's managing the State Water Board's response to the PFAS effort in the Division of Water Quality. Wendy graduated with a Bachelor of Science degree in geology from Sacramento State. She's a registered professional geologist in the state of California, certified project manager professional by the Project Management Institute. Today, she will discuss some preliminary results of California Water Board's PFAS testing of drinking water and potential sources. Wendy, you're on.
All right, well, good afternoon, everybody. You've heard the word State Water Board a lot. Well, I'm from the State Water Board. So we're going to talk about PFAS in the public water supply, currently a very large project that's going on right now. And so let me do the honors here. And okay. All right. Hopefully everybody can see the presentation. If I can get a thumbs up, that would be great. Okay, Laura, I can see you. Okay, so as the introduction, I work in the Division of Water Quality within the State Water Board, but both the divisions of drinking water and water quality have been working hand in hand for many years in regards to understanding PFAS, both at those industrial source sites that Emily mentioned, at those airports and landfills, but also in the public drinking water supply. So I'm going to go over kind of a little bit of a scope about where we are and where we have been collecting data. I got to talk a little about the maximum contaminant level regulatory timeline for the federal EPA in relation to what the activities are going on at the State Water Board. As a foundational portion of this is that we, as part of the State Water Board, issue monitoring orders in order to require monitoring and collection of data at either public water systems or at other parties, like at airports and landfills, in order to gather this information and data for PFAS. That's how we get that information to us. And as part of that, all that data that's collected, we knew that we needed to do some comparison studies in order to kind of understand the entire world of PFAS, not just what's on the targeted list. And that will lead us up to a recent order that was issued in 2024 for this large project that's going on right now, where we're sampling disadvantaged communities across the state. It's the Community Water System Project, and we'll go over some results. So that's what we're going to do. Okay, so we are using the good old iceberg analogy. That's our latest one that we're using. You know, folks understand that there are some targeted analytical methods out there that are being used to analyze for PFAS. In the drinking water world, that's EPA method 533. That includes 25 analytes. It includes those short chain. Emily kind of mentioned some long chain, and if there's any questions about what short and long are. And so it's a good kind of representation of the newer. There are some newer PFAS, the newer chemistry PFAS in that list, as well as the older legacy ones that are in there as well. There are other drinking water, other methods that we use in non-drinking water. And we're currently trying to understand these ultra short PFAS. These are the ones that are the C1, C2, and C3 PFAS. The ones that are on that 533 list are C4 and above. And those are really much smaller molecules. And we'll provide some information about data that we're seeing in regards to those. In complementary to target analysis, we're doing what we're calling kind of a proxy for total PFAS. It's not perfect, and that's using absorbable organic fluorine. That's a modified method based upon EP method 1621. And last but not least, we are fortunate to have funding in order to also include non-target analysis. And I'll talk about more a scope of the Community Water System Project coming up. But first, we got to talk about this regulatory timeline in regards to where we are in regards to EPA. EPA issued those maximum contaminant levels for 6 PFAS back in April of 2024, right? And there's an initial monitoring period going on right now for all public water systems to be sampling. We are trying to make it possible for this large statewide project that data can also be used as part of their initial monitoring. That will go on until 2027. And then after that, there's a post-monitoring period that's going to happen. And if the MCLs still hang in there, public water systems will have to be in compliance by 2029. They'll have to already be serving compliant water by 2029. So what we are currently doing is we're trying to understand what the total PFAS is in drinking water and really work towards, instead of a contaminant by contaminant, analyte by analyte MCL approach, in addition to try to understand PFAS as a class. and move forward with a treatment-based regulatory approach for public water systems. So I mentioned those orders that the State Water Board have to issue. In regards to drinking water, there are 2 orders that have been issued. One back in October of 2022. That was for all those public water systems that were in the vicinity of those industrial source areas that Emily mentioned. We're talking airports, we're talking about refineries, bulk fill terminals. They're all associated with the use of aqueous film forming foam, which has a source of PFAS. Chrome platers, they use a universal and had been using a universal mist suppressant for hexavalent chromium emissions. And those secondary receivers that receive PFAS, which are our landfills and our wastewater treatment plants. So those public water systems have been sampling since 2022 and are currently sampling on a quarterly monitoring schedule. In 2024, we were awarded some state funds from the general fund to initiate this project. And as part of that, the public water systems, all those that are serving disadvantaged communities as part of this scope. So it includes one-time sampling for all those water systems, those wells. As mentioned, as well as what Emily mentioned, these wells are being sampled, not what is being served. It is at the wellhead themselves. All of the samples are being analyzed for EPA method 533, and as well as absorbable organic fluorine, AOF. We're talking about 3,800 wells that are going to get these 2 analyses. We are supplementing about 20% of them because of costs, mostly, to analyze for ultra short PFAS. There's about 5 analytes on that list, and as well as non-targeted analysis on that subset. We are hoping, and we will have to be done by 2026 because our funding ends at that point in time, and we are on schedule to do so. In leading up to all of this were 2 studies that happened because it was really important in the drinking water world. We needed to understand what else was likely in and about, not just what's on the targeted list. There's a lot of research coming out and about that there's not just 25 or 18 PFAS analytes out there. There's a lot more than just that. And so in 2021, we went to, actually, Division of Drinking Water staff went to 9 drinking water supply wells all across the state. They were either associated with an airport or a landfill, somewhere where we knew that there were going to be PFAS in the well. We wanted concentrations in those wells. And we analyzed those samples using all the targeted analytical testing methods that were available. And we also used absorbable organic fluorine. And this is a representation of one of the well results. And it is showing that the absorbable organic fluorine is in the blue bar, and the rest of those bars are comparing other targeted analytical techniques. So essentially, what we are finding out back in 2021, which may not have been, not unknown, that there are a lot of unknowns that are not being picked up by the targeted method, and there are more perfluorinated or polyfluorinated alkyl substances in drinking water than what can be seen by targeted analytical techniques. So from there, 2 years later, we needed to go back to those 9 wells one more time. So we went back to those wells, and in this case, we also analyzed them for 533 again. We analyzed them for AOF, and we also supplemented for the ultra shorts. AOF is in blue. The sum of the 533 targeted are in that dark brown, and the gap between the 2 is the ultra shorts. Those are those compounds that are just not on the targeted list at this point in time. And so it can be quite a bit that can be associated with the ultra shorts in regards to drinking water. So knowing that, how are we going to regulate, right? How are we going to, we can't contaminant by contaminant. We've got to kind of get our arms around PFAS in regards to drinking water. So we were awarded a large, some bill funding in regards to the state fund. And we had several items that we needed to do in order to respond to that. One, we needed to select a PFAS broad spectrum method. The second one is this DAC order. We were going to go out, issue the order, and start sampling around 4,000 wells. There's actually about 3,800 now that's serving disadvantaged communities. The different analyses that we needed to do regards to those wells, and also understand more about ultra shorts, but really kind of understand what's going on in the non-target, what else could be out there in those. When we did the broad spectrum method, we picked AOF as our broad spectrum method. It's the most commercially available method that's available. There are others out there, but we found that it produced and shown better in regards to capture of PFAS in regards to drinking water in the state of California. This is a current status of where we are in regards to the sampling of statewide. The yellow are these wells that already have been sampled, and we are still sampling. Those ones that are planned are in green. This is about a month old right now. At that point in time, we have already sampled 1,700 wells. This is all being done under subcontract to Sacramento State University. The consultant is going around the state and collecting these samples. They're being sampled, and the samples are being sent to our state contracted lab, which is Babcock Laboratories, located in Riverside, California. Babcock Lab is currently doing all the analysis. Currently, they're doing the 533, the ultra shorts by ICM-SMS, and the non-target analysis by high-res mass spec. We're probably over 2,000 wells as we speak right now. But currently we're running at about, they're collecting about 170 samples that are going to set 170 wells a month right now, and touching about 39 water systems a month. Some water systems are much larger than others, and so some of that is going to vary month by month. But that is our current rate, and we can continue to accelerate that at that rate. We may be done early, actually, at this rate. And we'll see where we are, probably in early 26 where we are. So this is going to provide some data and to show some of the results based upon this sampling. This is as of data that was in our database as of in December. It's a couple months old, but there isn't much I anticipate changing from this. We're seeing a lot of non-detects, which is really great news and for the data of the samples that are coming in for EPA method 533. This is a percent detect chart. Your y-axis is the analytes. What are they being detected at? And on the x-axis are the analytes that are part of 533. They're grouped in specific groups from the carboxylates, the C4 to the C12s, the sulfonates, and the C4 to C8s. Those ethers, those polyethers, those are those kind of precursors. So they're the newer legacy. The fluorotelemers are definitely newer. PFAS, newer chemistries. The ultra shorts farther to the right, and then AOF to the farthest right in orange. We're currently only seeing a very few of the carboxylates and sulfonates at less than 10% detect right now. They are the same analytes that we have been seeing ever since actually sampling has been performed in the public water systems. They are predominantly the PFOA, C8 and C4 to C4 carboxylates. We do have PFHXS that was also mentioned in the sulfonate range and other sulfonates, as well as PFAS, PFOS. As you move your way farther to the right, we don't see any of the ethers. We don't see any of the fluorotelomeres in drinking water. And AOF currently is being detected a little bit over 30% of the time. The one large green bar that you see now, please keep in mind that the ultra shorts are being done on a subset of the whole. So there's currently about 227 samples that were a part of this chart, and every one of them is showing trifluoric acetic acid in them. This is a C2 ultra short. We do not expect and would not expect to see ethers or other newer chemistries. Those are precursors. I think what we're finding out, really understanding that, you know, most of those precursors they're definitely at the source sites. They are hanging around up there, but by the time they get to drinking water, they have already transformed. They are degradates, and they will show and come up either a PFHXA or other carboxylates. And that's what we're seeing in drinking water in so far. We do not see any of the precursors in drinking water that are on the 533 list. So these next two charts are going to kind of give you a range of concentrations that you see in drinking water so far at these disadvantaged communities, these public water systems. And so pretty much most of the bulk of the middle 50% of all the data is really less than about 20 nanograms per liter. Really low concentrations in comparison to this in the industrial source sites, where we can see multiple magnitudes much higher there. And so you can see the ranges of those in the carboxylates and the sulfonates regards to there. We have a couple that have a pretty high result. If you had noticed the maximum concentration for PFHXS and PFAS there, and a couple of that one pretty much, and the PFOA one. Though that is at one well that we know about. It is a well that's near an airport, and it currently has extensive treatment on it. And it's the only one that's actually at that high. But you can see what the median concentrations are all below 10 nanograms per liter. We're going to switch to the trifluoric acetic acid and the ultra shorts, and notice that the concentration on the y-axis up a magnitude. We see trifluoric acetic acid, I mentioned, in all the wells so far that are analyzed for them. And so our current median concentration as of this data set is about 600 nanograms per liter. I think in reference to this, I wanted to point out is that currently the European Union, I believe that the Danes and Germany are currently have their kind of maximum contaminant level for trifluoric acetic acid around 9,000 nanograms per liter. I think what we are seeing in general is that as you get a shorter chain length, in regards to PFAS, the toxicity, you know, it's not as terrible as PFOA and PFAS. It's still PFOA and PFAS are still going to be the leaders. That's why the maximum contaminant level is at 4. PFBS, MCL is around 2,000. That's a shorter chain. So we see just a little bit of TFMS. And of the other ultra shorts, we don't see them at all. These are the only two. This is it. So we decided we're going to do a heat map. And to orient you on this, the X and the Y axis are the same analytes. We start with a very short chain on the carboxylates and move our way up into longer chain, and then flip over to sulfonates and ethers, FTSs and the ultra shorts, and the same on the X as you move from left to right. Let's talk about the blank space. That's all non-detects. We don't have data, any correlations with it. It's all non-detects. We don't have enough data to correlate for those. Down in the lower left part of the chart is the correlations that we're seeing with those carboxylates. We are seeing carboxylates, as I mentioned before, which are degradates of other precursors that are in that association over there. We see a little bit up over in those sulfonates, that other part of that other little colored box towards the middle of the heat map. And the other thing that's very interesting is if you actually looked at AOF and you look for any correlation with AOF, we are not seeing much correlation with AOF with any of the other analytes. I looked at the data in particular, and we're only seeing in every well where we have an AOF concentration, only about 10% of them may have one of the other analytes in them, either PFAS or PFO or PFHXS. So that's something that we've got to think about and understand, but we need more data, and we'll continue to kind of ponder on why we are not seeing that much correlation with the AOF for that. So we then took a look at the results in regards to, and some of this may explain a little bit about the previous heat map, is that it has to do with detection limit. So AOF has a higher detection limit currently right now. We actually can receive estimated data. And so our current detection limit for AOF is around 200 nanograms of organic fluorine per liter. We converted all the PFAS analytes into our nanograms of organic fluorine per liter and summed them up, and that is represented by the blue bars. And then the orange bar is the AOF concentrations. So you can see kind of that hole in between there where we can't see with AOF. And so, but that's where most of the some 533 sums are located down in that lower range. Most of our data in regards to even adding up everything is below 10% of the wells, below 10 nanograms of organic fluorine per liter in almost 40% of the wells. And we have a lot of non-detects. We have both a lot of non-detects for AOF as well. So that is something we need to kind of work on and ponder. We'll get more data and look at that. We need to start pairing this. We currently are receiving a lot of data. There's so much data that is coming in that we're trying to keep above board. And so one of the things that we still have to work on and look at is the non-target. How does that and those non-target analysis, how do they relate to this AOF by abundance and in relation to the targeted as well? This is just a chart to kind of give you understanding of where there was some references to notification levels in drinking water. Currently, all these wells, we provide a notification to the water system what the results were. and where they are, there are certain actions that may be required based upon there are advisory non-regulatory levels that are issued by the Division of Drinking Water. This gives you an idea of comparison to the current EPA MCLs that have been issued back in April, and in comparison to the notification and response levels. Response levels means that the public water system either has to take the well offline, they either have to treat, or they have to do public notification. That means sending a mailer to your home address. They don't want to do that. Most of the public water systems are already reacting to the notification level, which is very close to what the MCL is for the EPA MCLs. Yeah, so that's where we are. And then if we were to take the actual data that's being reported for these water systems, this gives you an idea in comparison to them. The advisory levels are at the top of the screen and the federal MCL exceedances are at the bottom. We see we only have one exceedance of any response level for PFOA and PFAS currently. PFHXS is out there. That's the one. We have been hearing that the last hour or so about PFHXS. It is the one that's causing the most exceedances in regards to the public drinking water supply. In comparison to the MCLs, you can see kind of the relation there for those. So, but otherwise, the higher chain PFBS, that's much higher maximum contaminant level. We don't have any, won't have any exceedances most likely, and very little on PFNA. So all this does is kind of compare those exceedances based upon the DAC order versus the combine of all the public drinking water systems that are sampling and currently reporting. And you can kind of see the difference. We've had very low exceedances of the response level based upon the 4 analytes that are listed there that have notification response levels issued by the state there. But once you get closer to the source sites, those response level percentages go up. We are moving towards the source area there, and then we do have some exceedances there. The difference between the level of response level and the MCL is one little bit notched down, and there's quite a bit, there's going to be some differences there in regards to an increase that the public water systems will be moving towards in treatment. Last but not least, our last slide, and then I'll have my thank you slide after that. We look forward to questions or comments. This kind of gives you an idea geographically where the wells are currently have exceedances based upon the federal MCLs. A lot of them are located in Southern California. There is a lot of effort. There's currently 50 permits that are already issued by the Division of Drinking Water for PFAS treatment, and most of them are down in Southern California. A lot of those systems are already online and are either using GAC or a combination of GAC and ion exchange to remove PFAS from a drinking water supply. And so that kind of gives you an idea where we are. And I appreciate your time this afternoon. And I just want to shout out to my colleague, Dan Newton. He's the Assistant Deputy Director of the Division of Drinking Water. His nighttime job, other than regulating 4,000 water systems, is PFAS. So him and I are the ones that are trying to understand this huge world and be, the best to try to figure it out. What is the next steps for that? So I will end it there.
Thank you, Wendy. We have a few minutes for clarification questions, and then the remainder of the time until about 3:45 for panel and audience questions of various kinds, and then open discussion if there is some. Take it away.
And Jenny.
Hi, thank you for that very detailed talk, and not sure I followed all of this, and you may have already said this at the beginning, so this is just a clarifying question. Were these wells also, were you covering tribal lands in California as well as non-tribal lands?
Yeah, so I know of one system so that's a very interesting story, Jenny. So the EPA actually regulates tribal. There are some tribes that are being regulated by the Division of Drinking Water, but most of them are, as you know, are sovereign nations. And so there are very few tribal nations that are on this list. But the one that I know of is non-detect.
Thank you.
You're welcome.
Other clarifications?
Laura?
Yeah, hi Wendy, this was great. I learned a lot. I was curious, I may have missed it, but could you go over how disadvantaged community was defined in this 2024 order?
Yeah, it's based upon median household income. It's stated in the regulations in regards to that.
And I guess just a follow-up, like what proportion of community water systems statewide are designated as disadvantaged and being subject to this sampling that you described?
Well, it's my understanding that there's over 14,000 wells in the state of California, and we're trying to sample 4,000. And that gets
I have
you.
a question.
Not all water systems. Yeah. Some water systems, yeah, they're a combination. It's, not. There are some wells in some water systems are not considered disadvantaged. That makes a lot of sense, doesn't it? But anyway.
May I ask a question about the disadvantaged communities? Are the water systems obviously more contaminated? And if so, do you have a speculation about why?
I'm sorry, could you speak up a little louder, please?
In the disadvantaged communities, are the water systems more obviously contaminated with the PFAS? No?
No, in fact, that's one of the wonderful things about this. So far, we are not. There's some few outliers out there. I think every state is, trying to kind of noodle like, why is that there? But otherwise, overall, because such a low percentage of detection, like less than 10%, it has been wonderful news not to see PFAS in every well and everyone.
Just clarification, less than 10% of the wells tested in the disadvantaged communities had contamination problems?
Less than
that for
10% are detecting PFAS in the samples that are currently. So we're at that. We're currently at that point in time at 1,300 wells, and we're only detecting 10%.
If it helps, I could move this to the general discussion. We could cross the border and then we're on time.
Let's see, we have until from now till 3:45. You can edge us into that.
I mean, well, I don't know if it is, but it could be either one. So I'm curious about, so clearly, as is typical, California sets response levels, drinking water guidance that's slightly different from EPA. Right? Are there other states that engage in doing this, and are you going to compare, the California response threshold or limits to those other states, or is that relevant?
Yeah, that's a good question. A lot of states have been regulating PFAS for a while. EPA just issued theirs back in 2024. Some of those states over in the East Coast, sir, have had some significant issues, and they needed to move, and they need to regulate sooner than later, and so they have done so. Now, some of them are now going to have to figure out what the next step for them are, and may have to lower those. But yeah, there's a lot of states that have already been regulating for PFAS. It could be a single analyte. Some have gotten to the point where they're summing them up and using that sum as their approach for regulation. So it's all over the place, sir. I think the Division of Drinking Water will be lowering their response levels and notification levels down to the MCLs. So they're gonna match them.
Amy?
Oh, just to follow up, this is Amy Padula on what you just mentioned. So you expect the detection limits for the AOF to go down for the total PFAS, or not necessarily?
Not necessarily. No, I think it has to do with it's using combustion ionochromatography. We are currently using an extraction process that actually is one of the better ones based upon a study. And I can provide a link to that study if anybody's interested in that, in order to capture as much as possible. But maybe just it's going to be a limitation based upon the available technology. So
yeah, that's too bad, because I can see the conundrum.
oh, I know, right? And so we can't see that in drinking water. I think that's what we got to consider here in the state of California. Drinking water concentrations are not that high. I know they're above 4, but in relation to other states, you know, we don't have a primary manufacturer in this state of PFAS. Everything's coming in secondarily. And so all of our concentrations are much lower. And so that technique is great at a source site, great for screening. And so we're trying to figure out how we're going to move forward in regards to a treatment technology approach. Because one of the things that we're going to do next is we're going to actually go to treatment systems. And we're going to analyze those same set of analytes on the influent and effluent. What's actually coming into those systems and what's actually leaving those systems, and how much is that? But the silver lining, I think, is that the one thing, if you don't get anything, I think, is that what we're seeing now is what we have been seeing, and there hasn't been anything different, at least on the targeted list. And that's been a huge difference in regards to drinking water. We know we got some other unknowns, but we're getting there to try to understand what those are, and are they going to be an issue?
I think Jenny had her hand next.
I think you answered my question, Wendy, had to do with the treatment systems, so thank you.
Yeah. Jose?
Indeed, this has been a very educational presentation. I think the biggest highlight for me here is just the ubiquitous presence of the ultra shorts, the FTA, and all of the samples that you measured.
Yeah.
Which really makes it quite compelling to start considering this in biomonitoring, and also in expanding the measurements of this in many, many different places. I'm looking at right now at the map here, that geospatial, where you're showing the different areas in the state of California that had elevated or values exceeding the MCLs for various of the legacy PFAS. PFAS, but I really wonder what this would look like for FTA in particular. I'm guessing that the use of FTA must be very widespread. I do research with pesticides, and I know that they're being used for certain herbicides and certain fungicides. So bringing that, looking at the map here, it would be very nice to see how these different well sites in relation to proximity to agricultural crops may be related to this.
Yeah.
I mean, they're also used to get in medications, I believe, like Prozac, I think has some component.
Yeah, I don't know. I think,
Oh.
I don't think we've ever, or at least in my 20+ years career, ever dealt with PFAS before. You have such layered issues with it. First, you got the different chemistries, right? And different chemistries in regards to the evolution of making them, the phase out of them, and then the replacement products that then degrade to them, right? And so TFA is one of those ones that can be a degradant of another thing, but it can also be a source of something. And it was being used in the 50s widely, in the HFC market. And so you've got this combination. Once again, you've got this parent, but also can be a daughter, so to speak. And so it's just a crazy thing. And so since we're seeing it in drinking water, right, it had to come from somewhere, and it had to come, and it's been around a while. There's, some of these wells are really deep, Jose. You just don't get there immediately. So,
and unlike other persistence like PBDEs, there are no known natural sources of TFA or anything like that.
Right.
Yeah. So I mean, this is phenomenal work. It gives us a little bit of insights of that tip of the iceberg that you were showing us. Right?
Yeah, right.
All the PFAS
We're
that
trying to draw the water line down.
And it gives us, a pretty compelling rationale here for maybe those total PFAS that you're not really measuring and targeted, that may be these. So very educational, and at the same time, something that we need to be thinking a lot more also on the biomonitoring side.
I appreciate it. Thank you, Jose.
This is Narissa Wu from Biomonitoring California. I just wanted to address something Jose said. Thank you, Wendy. That was really informative. Yes, of course, all of this water data makes us think about what we should be measuring in humans, and we have been investigating the different methods that are available to us. They are unfortunately not standardized at this point, so it's we don't have a method that we can apply broadly, but we are planning to run a pilot with TFA, see how that looks with with a small subset of our samples. And we look forward to having more to fill in to help supplement some of this water data coming up.
Phenomenal. Thank you.
Martha Sandy with OEHA. So thank you, Wendy. That was a great talk. I'm thinking of your slide with the correlations of the different things that are measured, and that AOF, you're not seeing a correlation with other targeted PFAS, if you will, short chain or long chain. So I'm wondering, is the absorbable organic fluorine, that's going to pick up the pharmaceuticals, is that right? And so maybe that's what's missing, and some of the pesticides as well that are fluorinated.
Yeah, we already have looked at some of the non-targeted data, and that you got it. Yeah, that's all actually a lot of non-fluorinated. Not fluorinated, non-fluorinated.
This is Dina DeBraca, Biomonitoring California staff member. I was just wondering, you had a slide that showed that about.
Could you put
Okay.
the mic closer to your mouth? We'll hear better.
Okay. You had a slide that showed about 50% of all wells sampled had 0% detect for AOF, and in combination with 100% of your ultra short subset having TFA detected. Has the water board thought of creating almost exposure profiles for these wells? Like this subset of wells is TFA, nothing else. What's around them? Who do they serve? Where does it look like? This subset of wells is has maximum contaminant levels that we've studied for a long time and know about. Who do they serve? What's around them? That, yeah, that's the extent of my
Yeah, I
question.
think the one thing that you saw, except for at the end, was some kind of map. So that's where we are. We need to now kind of look at the geospatial relationships. And we're just we're still receiving data every day. And it's a small group of us that are looking at it. So those are really great ideas. We hope to be doing that. Hi, Laura. You got time to help us? No.
Yes, yes, we'd love to help you. I had one other quick question. Oh, I was wondering about the degree of overlap between your data and the UCMR 3 or 5, and if you look at all to see like time trends or correlations across those different sampling.
Yeah, there is some overlap. Yeah, but we know we haven't looked at that. And I believe UCMR 5 is not done in California yet. At least that was an email I saw a couple weeks ago. They're not quite finished.
Few minutes left. Questions? Any questions, comments? Substantive otherwise?
Nothing online at the moment.
Wendy, you seem to have silenced the crowd.
There's a hand up online on the Zoom.
Kanan? Did I say that right?
Yep, thank you. Thanks for the nice presentation. One question, I thought I saw in one of the slides, the sum of the targeted plus the sum of the ultrashort was greater than the AOF.
Yep, that's
Many
right.
knows.
How's that happen, Kanan?
Yeah. Listen to you first.
Yeah, there's more stuff out there, right? AOF's not perfect. I mentioned that. So, but it's the best that we're doing it all in a commercial lab, you know. So right now, that's what we have so far.
Okay, well, the general thought is that it's better than the TOF.
Yeah, that's interesting. I think for drinking water, probably. But I think that detection limit also has something to play with it a little bit, Kanan, as well. So we'll keep looking at ways that we've already done quite a bit on the extraction technique to try to not lose as many PFAS in the extraction process. But when you're talking absorbable organic chlorine, you're still talking a wax carbon cartridge. So it's whatever's going to absorb and stuff's going to pass through.
Science is evolving and
Yeah.
challenging.
Oh my God. We've gotten so far in the last 4 years. We have really leaps and bounds. Just having the ability to do non-target analysis on a commercial lab level is huge.
Thank you for sharing all these thoughts and data. And you covered a lot. Thank you.
We do have one more question. Toki, go ahead.
Hi, Toki.
Hi, Wendy. Thank you so much for this very interesting presentation. I was just wondering if you could expand a little bit more on the plans to monitor treatment systems, influent and effluent. Is that going to be on a small number of treatment systems or more extensive monitoring?
For the testing part to see what's there?
Yep.
Is that what you mean? Yeah, we need to probably start planning for that sooner than later. That same funds that's going to expire at the end of 2026 got to be used for that too, Toki. So we've got to do some update to our QAP and figure out which water systems are willing to help out here. We're looking for a good cross section of different water systems. They're currently already doing PFAS treatment across the state. Southern California is an obvious candidate pool down there, and they are receptive of that. But we also need to reach out to others across the state. But there aren't many other than really down in Southern California. So we can test different types of combinations.
Gotcha. Thank you.
Thank you.
Laura?
Hi, Lara Cushing again. I keep thinking of questions. I'm just curious if you could say more, or if you have given thought to surface water sources, and are they excluded because you don't think there's much potential for PFAS in the surface water sources, or they're just not as commonly used?
The bill funding was directed to groundwater, to wells. So that's why this study is focused on that. As part of the interim monitoring period, that's by the federal, right? With the MCLs, they have to sample both surface and they have to start. So that data will be coming in to find that out. We did do a study. We did a small study a year or so ago where we did sample along the Sacramento and Feather River in regards to water intakes, and we didn't see anything. But, you know.
Other questions or comments? We have 15 minutes of allotted time if you wish to use it. But
We can move to open public comment. Do you want to announce the open public comment, Carl? And thank you so much, Wendy.
let's see, so for the wrap-up period, the listeners should know that web attendees can submit written comments and questions via the Q&A function of Zoom webinar or by email to biomonitoring@oehawk.gov.california.gov, and we will read them out loud. If you wish to speak, please alert us during the raise hand feature of the program, and Rebecca will call on you at the appropriate time. If you're attending in person and wish to comment, please come in, raise your hand. I will call on you. For the benefit of the transcriber, please clearly identify yourself before providing comment. So those are the ground rules for the last 15 minutes. Opportunity to submit comments.
Yep, any public comments are welcome on anything we've discussed today or anything else. No public comments at this time.
No public comments? No in-room comments? Is there a move? I don't think we're on Robert's Rules of Order, but is there a move to adjourn?
You can go ahead and wrap up.
Did I miss something? Oh, wrap up an adjournment, sorry.
Other side.
There we go. So a transcript of the meeting will be posted on the Biomonitoring California website when it's available. The next Science Guidance Panel meeting will take place on August 27th, 2025 from 10 a.m. to 4 p.m. in Sacramento. That's an important difference. Information regarding options for attending the meeting will be made available closer to the August meeting date. So this meeting obviously is here in Berkeley, you're all present. The next one is Sacramento. That's a little trickier to get to. And thank you, panel, and thank you, audience. And the staff has been most helpful. We appreciate it. Thank you.